Okay, so which of the following proteins is most likely to be the precursor of the deposited material? So looks like we're dealing with hemonc. So 70-year-old woman with a history of rheumatoid arthritis presents to the clinic with worsening fatigue, peripheral edema, and dyspnea. On physical examination, she has periorbital purpura and an irregular pulse, AFib. ECG revealed, okay, AFib. A biopsy of the abdominal fat pad is performed, and the histopathology reports showed deposition of eosinophilic amorphous material that stains positive Congo red. So right there, I'm thinking amyloidosis, but we'll keep going. And then you have apple green birefringence under polarized light, which also amyloidosis. Which of the following is most likely to be precursor of the deposited material? So just seeing the Congo red, apple green, I'm thinking amyloidosis. But looking at our answer choices, there's a couple things that can be associated with that. So if we look back up at the stem, she has rheumatoid arthritis, fatigue, edema, dyspnea. She has this periorbital purpura and then AFib. So let's see. So when I think of serum amyloid A, I'm thinking more of Alzheimer's, and she doesn't have any symptoms of that. Mutant globulin light chain, I'm thinking more like multiple myeloma. And then transthyretin, I know, has to do with the heart, like dilated cardiomyopathy. So I would say transthyretin.
All right, so it's actually serum amyloid A. So the reason why is because this is actually secondary amyloidosis, if you remember that, right? Inflammatory process due chronic disease. And so how that usually happens is the precursor is going to be serum amyloid A, which then kind of stacks on its other and causes amyloidosis. The one that you're thinking about for Alzheimer's is slightly different. Let me look at kind of what it is exactly. I forgot what amyloid for Alzheimer's.
I think it's alpha beta amyloid, but I forget
Yeah,
what.
it's beta amyloid.
Okay.
So this is going to be slightly different, right? Different amyloid. But yeah, for kind of secondary amyloidosis, you want to be thinking about amyloid A, which is kind of usually caused by the inflammatory factors of some kind of autoimmune disorder or some kind of chronic inflammation. Let's just leave it at that.
Okay, I'm gonna write that down really quick. So we're saying secondary amyloidosis is more of serum amyloid A. Okay.